600 confirmed deaths in the DRC, and the treatment center, where the next patient may need a bed, is at 96% capacity. If you're just joining us, we're talking about the Bundibugyo outbreak in eastern DRC. Earlier reporting put it at 1,561 confirmed cases and 506 deaths, plus 354 suspected cases across 36 health zones in Ituri, North Kivu, and South Kivu. WHO has called it expanding, not stabilized, so every update comes down to whether transmission stays geographically contained and whether response teams can keep pace.
This is Ebola Watch. Today, 600 deaths, a nearly full treatment center, and a French doctor who walked out recovered. We'll start with the number that changes what a full hospital actually means.
Here's Al Jazeera.
At least 600 people in the Democratic Republic of the Congo, DRC, have died from Ebola, as the number of confirmed cases of the illness rose to 1,759, according to government data. The total numbers, released on Wednesday, were confirmed as of Tuesday, while 51 new cases and 20 deaths were recorded in the previous 24 hours.
600 confirmed dead. That's the line on the DRC report today. 1,759 confirmed cases, and 20 of those 600 deaths came in a single 24-hour window.
And the number I'd sit with alongside it. 51 new confirmed cases in that same day. This is still the Bundibugyo outbreak we've been following. Confirmed deaths are at 600, with Kisangani cases still awaiting validation, so they're not in that total yet.
Kisangani. That's the part that made me stop, Sarah. That's one of the country's biggest cities. And one of those two cases has no geographic link back east?
That's what the government is saying, per Al Jazeera. 2 suspected cases, results still being validated, and not folded into the count unless they're confirmed. Which is exactly why suspected and confirmed can't be treated as the same number. But an untethered urban case is the detail that could change the map.
And buried lower in that same report, health workers in Ituri walking off the job over unpaid wages. The hardest-hit province and the people fighting it aren't getting paid.
Unisamolo, writing in the Standard Health.
The recovery of a French doctor infected with Ebola has provided a rare glimmer of hope amid the world's largest recorded outbreak of the Bundibugyo strain, even as health authorities warn that treatment centers in the Democratic Republic of Congo, DRC, are nearing full capacity.
Before we even get to the recovery, put 96% on the table. Treatment centers in the DRC are almost full. So the question a Peace Corps parent asks is the one that matters. What happens to the next sick contact when there's no bed?
And that ceiling reframes the death toll we hit earlier. 51 new cases in a day lands differently when the system absorbing them is at 96% capacity. At that point, every new case is a capacity problem too. The French doctor's story is genuinely good news. Recovered, no secondary transmission. But look at what made that possible. A high-security infectious diseases unit, rapid detection, isolation. A French hospital can offer that standard of care. A treatment center in eastern Congo that's running out of beds can't.
Right. And this is the Bundibugyo strain, which, per the standard, has no licensed vaccine and no curative treatment. So there's no drug story to hang this recovery on. The setting mattered, where they got sick and how fast they were isolated.
From Niger report.
The Ebola outbreak, which was declared on May 15th, has now spread to 36 health zones across the provinces of Ituri, North Kivu, and South Kivu. Community transmission of the virus continues to occur in these areas.
Watch the arithmetic in this Niger report figure. 1,561 confirmed cases, 506 confirmed deaths, 253 recovered, 628 still in isolation. Those are 4 separate buckets, and they don't blur into each other.
And it maps mostly to one province. Ituri is 91% of the cases and 84% of the deaths. So when we say DRC outbreak, we're really talking about one corner of the country.
As of July 1, 10,821 contacts were under monitoring in Ituri and North Kivu. That's the tracing machine trying to get ahead of a Bundibugyo strain WHO says is still spreading sustainably.
10,000 contacts. Put that next to the 96% capacity number we just hit. Where does a monitored contact go when they turn symptomatic and the beds are gone?
Put the two reports together. Niger gives you 628 currently in isolation. The capacity figure tells you there may be almost no room for number 629. Here's the nation.
The minister thanked the Chinese government for sending medical experts at a critical stage in the DRC's fight against Ebola, saying the outbreak remains a difficult public health task for the country. China has honored its commitments and acted on its word by providing practical support to help the DRC strengthen epidemic prevention, control, and public health emergency response capacity, Kamba said.
So, here's a name that hasn't come up on this show before. Chinese Ambassador Zhao Bin, sitting down with DRC Health Minister Kamba, with Chinese medical experts already on the ground. That's a bilateral lane running alongside the WHO and Africa CDC channels we've been mapping.
And the timing is what makes me lean in. Kamba is talking up surveillance, clinical treatment, and personnel training with China, while the pathogen access and benefit sharing fight is still live at WHO headquarters. A major non-Western actor going on record backing DRC's response lands differently in that context.
Does that lane compete with the multilateral system, or just fill a gap it's leaving? Because after the 600 death number we opened with, and a treatment center at 96%, Kinshasa's going to take help wherever it's real.
I'd hold the judgment for now. Kamba's word is practical support. Experts in the room, no dose in a fridge. Whether that turns into surge capacity at a place like Rwampara, we don't know yet. It's a diplomatic readout, and I'll read it that way until the deployment figures show up. Avian Flu Diary writes,
As of today's date, the overall risk of Ebola disease caused by BDBV for the general population in the EU/EEA is assessed as very low. The importation risk is estimated by ECDC to be approximately 1 importation per 24,000 travelers, 90% uncertainty interval, UI, 13,000 to 54,000, from the main outbreak region, North Kivu and Ituri, DRC, to the EU/EEA, with a low probability.
Okay, this is the one I want to sit with. ECDC just published imported case guidance for every EU and EEA country, a checklist for what happens if Ebola shows up in a European hospital. When Brussels writes that document, it's a preparedness signal.
And note the date on it. The checklist itself is stamped June 18th, but it lands the same week Hong Kong ran a full interdepartmental drill. 2 health systems, continents apart, both gaming out the same scenario.
So here's my worried traveler question straight up. Does CDC's very low risk to Americans line still hold when Europe and Hong Kong are actively rehearsing for imported cases?
It holds, and both things are consistent. Preparedness planning is what agencies do precisely so the risk stays low. The ECDC even keeps the overall importation risk graded low in that same document. Rehearsing a scenario isn't a prediction it'll happen.
And we already have the proof of concept, the French doctor. First confirmed case in France, tied to this outbreak, and according to today's standard piece, recovered. That's exactly the scenario this checklist is written for.
That's the reassuring read. An exported case was caught, treated, and survived. That's the pipeline working. The ECDC guidance is trying to make that outcome routine.
If Ebola Watch helps you stay informed, take a moment to subscribe and leave a review wherever you're listening. It's a small gesture, and it helps other people find the show and follow the latest developments. Next, we're watching the confirmatory testing for the 2 Kisangani illnesses. That will tell us whether Chopo province enters the official case total. We've put links to every story from today's briefing in the show notes, so if one of them caught your attention, you can follow it there. That's Ebola Watch for Thursday, July 9th. This is a Lantern podcast.